Collective human nature is inherently evil. Common will, as it is transmitted by the numerous individuals composing society, is diluted, concentrated, reflected and refracted in ways which will make us more wanton and negligent than we know. The evil of the populace is entire orders of growth above the sum of the evil of its constituents. Progress in civilization has been the product of continuous effort of identifying the hideous embodiments of such evil and acting to combat them. In antebellum America, the penal system was identified as such an evil. Initially, there were virtually no standards for prisons. Internal conditions were wretched and persons of all varieties were indiscriminately kept in the proximity of the wicked. Through the efforts of a number of individuals and groups, the unacceptable conditions of the prisons were brought to light, and efforts were often successfully made to correct them. Before this reform movement, prisons largely served the practical purpose of storing individuals unfit to walk amongst the general populace. This they did efficiently, with disregard to other things. Prisoners were often kept in poor conditions, sometimes their jailers even neglected their health. Adolescents were imprisoned in the same buildings as adults, and female and male criminals were not kept entirely separated, implying women guilty of only minor crimes could be imprisoned alongside those guilty of sexual offenses or even rape. Despite these generally terrible conditions, the mentally ill had a situation still worse. These people were lunatics by misfortune, not by any fault of their own. Prisons made no effort to treat them. In fact, they had the inverse effect. They traumatized these poor individuals who lived amongst the heinously evil, were often confined in small cells, even cages, sometimes physically constrained, and, unlike the criminals, who only had to serve their sentence, the insane were damned to remain within the prison's walls until the day of their death. Occasionally, the insane were kept in poorhouses or private residencies, but there they met similarly horrifying fates. They were simply confined because the facilities were not equipped to care for them. In some of the worst cases, they were caged, tied down, and even beaten. Although these insane may have had no hope, there was faint hope for improvement in the overall system. Changes were made. The question arose, should prisons punish or rehabilitate? The side for rehabilitation gained some ground. Prisons were improved, and asylums and psychiatric hospitals were created. First in the chain of events leading to the penal and asylum reform was the exposition of the need for it. Through the work of several persons, the failures of the existing system were documented. One of these individuals was Dorothea Dix. Dix made a tour of various prisons and almshouses, first in Massachusetts but later in other places. She kept a detailed journal in which she recorded her findings. In Concord, she documented a lunatic woman from the hospital staying at the almshouse. She was kept in a cage for lack of another way to restrain her. In Medford, Dixon saw an idiotic subject who was chained, and another who had been kept in a stall for over 17 years. In Granville, she observed a person confined to such a space that they were losing the function of their limbs due to lack of exercise. Dix would later go on to inform the legislature of what she saw and petition them for reform. Another individual who identified the damages within the system was Dr. Samuel Gridley Howe. Howe was largely an educator and rights advocate for the impaired, specifically the blind, deaf, blind, and mentally impaired. Furthermore, he was a strong abolitionist. He observed prison conditions in a number of cases when working with fugitive slaves, and he did some degree of advocacy for the improvement of such conditions. However, the vast majority of his work known to history was in the area of special education. Conversely, Dorothea Dix is known primarily to history for her work in penal and asylum reform. After a tour of Massachusetts prisons and almshouses, she presented to the state's legislature what she had seen, along with an argument for the provision of better psychiatric hospitals. After some debate within the legislature, her proposal was accepted. Following this success, she went on to observe prisons in other states and petitioned the governments to reform as needed. She was extremely effective in these tasks and undoubtedly contributed more than any other individual in producing adequate treatment for the mentally insane. She would later go on to Europe and get similar reforms made in numerous countries within a span of only 2 years. Yet another influential individual in the process of penal reform was Francis Lieber. Lieber was primarily an author and theorist of law and government. He wielded great influence, having written several important books in his fields, and being the primary informant of Alexis de Tocqueville. His notable contributions to the movement involved the composition of a handful of works on penology, which included arguments innovatively using empiricism. Through the works of Dix, Howe, Lieber, and other reformers, improvements were finally made. It was recognized that mental illness could be treated through medication or therapy, and psychiatric hospitals were created to achieve this purpose. The insane were taken out of prison. One factor permitting the creation of psychiatric hospitals was improvement in psychological research and therefore better understanding of the nature of mental issues. One of the people who contributed to furnishing these improvements was the author Harriet Martineau, often called the first woman sociologist. Among her various works, she wrote a book on how to properly conduct social research. As research improved the field of psychiatry, it was applied at an unprecedented scale in the new hospitals, one of which was the Eastern Lunatic Asylum in Kentucky, which was headed by Dr. John Galt, a pioneer in the area of asylum superintendence. Dr. Galt was influential because he sought to treat the insane living in his asylum, not simply house and contain them, but better their condition by therapy. He believed that it was the asylum's moral duty to try to help its residents, regardless of how little hope they had for permanent recovery. In addition to the asylums, prisons were also reformed. Male and female inmates were separated, and juvenile detention centers were created to handle child criminals. The view that prisons should serve the purpose of rehabilitation gained support, and many prisons were modified to reflect this. Even libraries and Sunday schools were added to some facilities. Through the dedicated efforts put forth in this movement, the incarceration system was rendered far more humane. Children were freed from prisons, newer prisons were made less hellish, rehabilitation facilities were added to some prisons, and an effective asylum system was created for treating the mentally insane. By the completion of the movement, America served as a model to Europe for humane processing of criminals. Despite these impressive gains made by the movement, much remained undone. It was not definitely decided whether prisons were more to punish or to rehabilitate. The field of psychiatry was still relatively undeveloped, and many asylums were segregated, undoubtedly denying many insane the treatment they needed simply because of the color of their skin.